see an NCLEX RN video based on care for patients with musculoskeletal disorders. What is the main nursing intervention in caring for a patient with muscular dystrophy? Prevent falls and fractures, promote comfort and function, prevent cardiac and pulmonary dysfunction, promote collaborative and genetic care. The primary goal for a patient with muscular dystrophy, when we are caring, we need to prevent falls and fractures. Secondary goal is to promote comfort and function. Nursing interventions will prevent cardiac and pulmonary dysfunction, but we should assess for them and promote collaborative and genetic care also. What is the dynamic and ongoing process of bone changing? Osteoclastic activity, osteoblastic activity, bone remodeling, bone mineral density. Bone changing, it is also referred as bone remodeling due to the combined action of osteoclast and osteoblast. Bone mineral density is a measurement of the strength of the bone. Total joint replacement therapy is most common for musculoskeletal disorder. Paget's disease, osteosarcoma, osteoarthritis, osteomyelitis. Osteoarthritis is the most common indication for total joint replacement therapy. Which is the highest priority intervention associated with osteomyelitis? Limb salvation, pain reduction, flexion precaution, fall precautions. Pain reduction and fall precautions are important in osteomyelitis, but the highest priority with osteomyelitis is limb salvation. Flexion precautions are more often associated with post-operative care after joint replacement. The nurse understands osteosarcoma primarily occurs in which age group? The elderly, the very young, middle adulthood, adolescents. So osteosarcoma occurs primarily in adolescents. The nurse recognizes which patient is at great risk for development of Duchenne muscular dystrophy. Female at birth, male at birth, female at adolescence, male at adolescence. So this Duchenne muscular dystrophy is an inherited X-linked recessive trait. So it occurs in male and at birth. The nurse recognizes that which of the following pathophysiological manifestations are associated with muscular dystrophy? Decreased tissue oxygenation, decreased blood flow to muscles, degeneration of muscle fibers, decrease in enzyme activity, increased muscle bulk. In muscular dystrophy, there is reduction in the muscle bulk, not an increase. There is also decrease of blood flow to the muscles. So it results in degeneration of the muscle fibers, and over time it will affect the tissue oxygenation. Also related to the enzyme activity, it is increased. So in this, the pathophysiological manifestations associated with muscular dystrophy are decreased tissue oxygenation, decreased blood flow to muscles, degeneration of muscle fibers. Which of the following is a risk factor associated with osteoporosis? African American, weight greater than 58 kg, Hispanic, weight less than 58 kg. Osteoporosis, it primarily affects the non-Hispanic, Caucasian and Asian women, and women who are aged above 50 years or older with a smaller body frame. So here the weight less than 58 kg. Medical management of Paget's disease is based on which of the following characteristics? Presence of symptoms of active disease, distribution of the Pagetic bone, metabolic activity of the Pagetic lesion, absence of symptoms of the active disease, decreased calcium and phosphorus levels. So the medical management of Pegas disease is based on presence of symptoms of the active disease, distribution of the pegatic bone, metabolic activity of a pegatic lesion, absence of symptoms of active disease. Changes in calcium and phosphorus may be present but do not predict the treatment. John, a 28-year-old man, has been recently diagnosed with osteomyelitis following an open reduction internal fixation to his tibia fracture. What is the most appropriate nursing diagnosis for John? Hypotension related to tibia fracture, infection related to tibia fracture, fear related to tibia fracture, pain related to tibia fracture. Hypotension, fear and pain may be happening in the patient, but in actuality, if you see, osteomyelitis is an infection within the bone. So the best nursing diagnosis is infection related to tibia fracture. What is considered a nursing priority for a patient with scoliosis? Maintain bed rest, encourage exercise, restrict fluid, restrict pain medication. A progressive exercise regime and pain management are treatment priorities. Fluid restriction is not indicated. Which symptom is an appropriate indication for total joint replacement? An inability to perform activities of daily living without pain, a desire to participate in contact sports without pain, a knee injury that may restrict aggressive skiing, a hip injury that restricts a prior running routine. So here the appropriate indication for total joint replacement is an inability to perform activities of daily living without pain. A patient is post-operative day 1 following a surgical procedure after a recent diagnosis of osteosarcoma to his tibia. The nurse recognizes the patient has good understanding of his diagnosis by which statement? The doctors opened my bone to take a biopsy for the diagnosis. The doctors opened my bone to take the tumor out and all the tissues around it. The doctors opened my bone to remove dead bone. The doctors opened my bone to clean out the infected area. Surgical repair usually involves removing the tumor and all of the muscle and related tissue around the tumor. So the best response is the doctors opened my bone to take the tumor out and all the tissue around it. Evelyn is a 55-year-old female patient who presents to her healthcare provider with complaints of increasing difficulty in walking, increasing pain in her lower back and showing early signs of kyphosis in her posture. She is currently on no medications and states she takes a multivitamin and calcium when she remembers them. Aileen has returned to her healthcare provider with complaints of increasing pain in her lower back and the feeling like I would fall while walking. Her kyphotic posture appears to be worsening and her height is measured. It is noted that it has a decrease from 5 feet 3 inch to 5 feet 2.5 inch over the course of the year. She remains on her medication regime of multivitamins and calcium and states she has begun to take Aleve naproxen for pain. She is very concerned about her fear of falling, increasing level of pain and decreasing level of function. Ms. Afflin demonstrates classic signs of osteoporosis with vertebral changes noted as kyphosis or Dowager's hump. She states that she has noticed that her pants seem longer. She complains of back pain and increased difficulty with simple activities of daily living such as short walks. Initial diagnostic reveals an elevated ESR, decreased serum calcium level and a minus 2.5 t-score for bone mineral density study. The results are consistent with primary osteoporosis. The healthcare provider orders Ms. Aileen to begin biphosphonate therapy with ibandronate or Boniva by mouth. Ms. Aileen demonstrates the need for more teaching by which of the following statements? I don't need to take calcium or vitamin D anymore. I know I need to develop an exercise plan. I may need to remove a load of the small throw rugs around the house. I know I will need to follow up on a regular basis. So further teaching is required if she says, even after Boniva therapy, calcium and vitamin D are still necessary. So if she says I don't need to take calcium or vitamin D anymore, that means she needs further teaching. The rest of the all the statements are correct. Follow up and exercise, that's essential, and small throw rugs are a trip hazard. The nurse understands which screening tool will help evaluate fracture risk. Fracture risk assessment tool, FRAX, medication, dietary, activity. The proper use of medication, healthy dietary intake and activity are essential components of care, so should be evaluated, but the FRAX screening tool specifically evaluate fracture risk. So FRAX need to be done. Miss Helene's greater risk factor for the development of osteoporosis is which of the following? A low bone mineral density, a high bone mineral density, a low fracture risk assessment test or tool, a high quantitative computed tomography. So here a low bone mineral density test. It is a good predictor of fracture risk and osteoporosis. A low FRAX indicates low fracture risk. A high QCT indicates strong bones. The nurse understands which of the following is an important teaching point for Miss Ellie. Boniva must be taken on an empty stomach. Boniva is taken once a week. Boniva may cause joint pain. Boniva is taken instead of calcium. Boniva can cause gastrointestinal irritation and must be taken on an empty stomach. It is taken once a month. It does not cause any joint pain and should be taken with calcium. So here important teaching point is Boniva must be taken on an empty stomach. The nurse understands which of the following is implicated in the development of osteoporosis. An increase in calcitonin level, a decrease in estrogen level, a decrease in the parathyroid hormone, a decrease in phosphorus level. A decrease in estrogen level inhibits the bone formation. Calcitonin decreases osteoclast activity. Decrease in parathyroid hormone would decrease osteoclastic activity. A decrease in phosphorus level is inversely proportional to an increase in calcium levels. So here in the development of osteoporosis, a decrease in estrogen level plays a part. Hope you understood this video. Thank you so much.